So hey guys, so what we're gonna do is we'll work out the poll, we will take it, but we're gonna go ahead and introduce our first featured speaker who is going to be telling you and unveiling some incredible information for basically Carson Valley, but the entire region. So Sam, let's take it away.
All righty.
Thank you.
Well, we're very pleased. I got a little preview of this last night to welcome Jeff Prater. He's the CEO of Carson Valley Medical Center. Come on up here.
All right, thank you very much.
Prior to you even making the announcement, I just want to say congratulations on what is stunning news for the Carson Valley, and it's going to improve the life of everybody living in this valley.
Awesome. Well, thank you very much.
You.
Glad to be here. We have the clicker. Awesome. Well, good morning. I am Jeff Prater, and for the last 3.5 years, I have served as the CEO of Carson Valley Medical Center. Prior to that, I started my healthcare career back in 1992 as a hospital corpsman in the United States Navy. And before I get started, I really want to thank Renee. I know that we've been waiting to unveil this announcement, and it's very exciting to have this opportunity at this platform to provide this. And I want to thank Renee Louie for that. In addition, I'm also on the board for the Business Council of Douglas County. And I know a lot of the hard work that goes into doing this, and I just wanted to say thank you, especially for having to shift so quickly, given the changes that we've had to go through recently. I'm very excited to be able to announce some things today and present today to you on this stage and on this platform. Before I really get into that piece, I think it's very important to really reintroduce, if you will, Carson Valley Medical Center and who we are today and where we're going. So Carson Valley Medical Center is a 23-bed critical access hospital. We're going to talk in just a few minutes about what a critical access hospital really is. But we are 23 beds, licensed beds, and some people may or may not know, but we are a partnership between Renown Health in Reno and Barton Health in South Lake Tahoe. And so my board is made up 50-50 of both of our partners. And today on your screen, you see 5 of our board members. We have 1 empty seat, but we have Dr. Clint Purvance, who is our board chair and the CEO of Barton Health. We have Cy Johnson, who is the Renown Health Chief of Staff. Ann Beck, who is the CFO of Renown Health. And we have Dr. Paul Fry, who is a physician at Barton, and also the CFO of Barton Health, Kelly Niger. So really, I'm blessed to have such a great board of directors, a lot of experience in guiding our facility, and really keeps me on my toes. But I wouldn't be remiss without really introducing the team that works hard every day at Carson Valley Medical Center. And it starts with the team here that you see. Besides myself, our CFO, Colleen Reed, our Chief Medical Officer, Evan Easley, our Director of Operations, Shannon Albert, Director of Nursing, Andrea Heifel, and our Director of Clinics, Gina Zink. Now, at Carson Valley Medical Center, we only have board-certified physicians, and this is our physician leadership that leads a medical staff of over 147 providers. We have radiologists and our Chief of Staff, Dr. Robert Silk, and we also have an emergency room physician and our Vice Chief of Staff, Dr. Targi Overos. At Carson Valley Medical Center, our mission is to care for your health and wellness, and our vision is to strengthen our community by providing accessible, affordable, and high-quality health care for all. So, hot off the presses, if you will, what you see here is really our 2020 data that's been recently released. And just wanted to show this today, kind of by the numbers, if you will, what Carson Valley Medical Center has been doing. And really, this data is during a COVID year. And so we see some really interesting information for us as it pertains to our volumes and things of that nature. And I can say that as we talk today, I have no doubt that we're going to blow some of this information out of the water. In our community benefit, Carson Valley Medical Center provides about $558,000 in community health and wellness, and then in community support of about $42,000 a year. Now, I promise, this is my only COVID slide, and it really is not to talk about COVID. One of the things that during 2020, when our staff were really dealing with something that they didn't know anything about, none of us knew anything about, was our community going on lockdown and our staff going through some things and working with patients. But you know what? Our community stepped up. And what you see here is really donations to us from all of you. And our community really helped to provide some of those items that really the industry was falling short of. We couldn't procure a lot of the items you see on your screen. But our community came together as one and really helped to provide that. And so I thought this was a great opportunity, especially looking at all the businesses. I wish I could name every business that helped to donate items to us. But on behalf of Carson Valley Medical Center's staff and providers and our board, I just want to say thanks to all the businesses out there. So Carson Valley Medical Center it serves a population of over 55,000 people, not just here in Douglas County, but also in Lyon County, Mono County, Alpine County. We're the 5th largest employer in Douglas County and the 3rd largest private employer. And we provide to the community of about $6.5 million a year in uncompensated care. And as I mentioned just a few seconds ago, about $550,000 in community health improvement initiatives. Carson Valley Medical Center also has 6 locations. Our main campus is in Gardnerville, and that's where our hospital is. And across the street is 2 of our clinics, Job's Peak and Senior Care. And then up in Minden, we have 2 locations as well. One of those is our Minden Family Clinic, and the other is our Ironwood Medical Center, where we provide urgent care, primary care, and our occupational health as well. And then down south in Topaz Ranch, we have our Topaz Ranch Medical Clinic to serve the population there. So just briefly, I want to provide just a quick history of Carson Valley Medical Center for those of you who may not be aware of that. So in 1993 is where it all started, and I think it's kind of ironic that I got my start in healthcare in 1992, and just right after that, Carson Valley Medical Center, they knew I was coming. So I really appreciate that. But we started providing care, primary care and urgent care and some support services in 1993. And then in 1995, we expanded to our outpatient surgery and 24-hour emergency room. In 2004, we opened the hospital. We actually became a hospital in 2004, where we began as a 15-bed licensed critical access hospital. And then in 2006, we opened Topaz Ranch, as I mentioned, down at Topaz Ranch Estates. In 2008, we added Job's Peak and Minden Family Medicine. In 2009, we added Senior Care, which is really offering complete care to patients over 65. And then in 2010, we actually started Vitality for Life, which is providing mental health and wellness services for patients who are also over 65 years of age. In 2014, we opened the Ironwood Clinic that I mentioned, our Ironwood Medical Center that I mentioned earlier with our urgent care. And in 2019, we began our behavioral health and child adolescent program. So I just want to pause for a second and really, I know I get a lot of questions. Jeff, what is a critical access hospital? And I hear things like critical care access and things just, people just chopping it up a little bit, and because really, we don't really understand what that is. Well, critical access hospitals came to be due to the Balanced Budget Act of 1997. And it really because of the fact that there were a lot of rural hospitals that were closing down because they couldn't afford to open their doors, they couldn't afford the cost due to the reimbursement that was happening, and just the volume was so low. So during that Budget Act of 1997, they then created the designation, which is what a critical access hospital means. It's a designation for a hospital. And there's some rules that revolve around that actually allow critical access hospital to do certain things, but I'm just at a high level just going to mention just some really 4 key rules of what for a facility to be a critical access hospital. And number 1 is you can have no more than 25 acute care beds. There's a distance rule of 35 miles, and 35-mile drive from another hospital or critical access hospital unless that facility has a waiver. But this also excludes Indian Health Service facilities, because Indian Health Service facilities are exempt from the distance rule, either us to them or them to us. A critical access hospital also must provide 24-hour emergency room services. And that can be either open the doors 24/7, or it could be someone on call that responds to the emergency room when someone arrives. And that could be a physician, or that could also be an advanced practice provider as well. And then one of the things that we're held accountable to is our length of stay. In a critical access hospital, when Centers for Medicare and Medicaid Services show up at our door and they do a survey for us, one of the things they ask us to pull is give us your length of stay. And so for a rolling 12 months, we have to show that our patients do not stay in our facility longer, on average, 96 hours. And so that really is what that's all about. Now, I tell staff, I tell my team a lot of times that when you've seen one critical access hospital, you've seen one critical access hospital, and that's it. And the reason for that is we really, from one critical access hospital to the next, we really serve a very different population. And so you can see critical access hospitals that really just turn on their lights when the emergency room has a patient. And that might be a couple of days in between. And then there's critical access hospitals that provide 24/7, 7 days a week, board certified emergency room physicians like Carson Valley Medical Center, and provide a plethora of services. And on your screen, I'm bringing up just some services that Carson Valley Medical Center currently provide, either through providers that are on site or those that come to visit us. But you can see we provide cancer care, cardiology, orthopedics, behavioral health, surgical services, PTOT speech, just a whole array of services that we provide. Now, if you remember, I mentioned that we started back in 1993. Well, in 1993 was when the front half of our facility was built. And in 1995, the back half of our facility was built. And when you start combining different types of facilities, from outpatient clinics to inpatient care types of rooms, well, the rules change from those when it comes to what the regulations are for how those rooms are put together and what creates all the safety aspects of those rooms. On top of that, as we move forward in time, those rules change. So we have these FGI guidelines, which is the Facility Guideline Institute, and it tells us how we have to build our facility when it comes to healthcare. And we also have a lot of, so those create some issues. And we also have some efficiency issues within our facility for us to provide care, really for our staff. And if you come into our facility and you go upstairs to the second floor where our inpatient unit is, then what you see is you go to the left, then there's 15 beds on that side. Then you walk down the other side and there's 8 beds on that side. And so it creates some efficiency issues with staffing, with how our flow happens within our facility, and creates a big issue. In addition to that is when we have double occupancy rooms like we have today, we have 9 of those, so 18 of our beds are in the same room, if you will. And so what happens is we have a male-female odd count, if you know, going forward with us, then it creates some issues where we may have an empty bed and we're not able to admit another patient, and someone from our community has to go somewhere else for services. So that creates issues not just for us, but also for our patients. Then there's also the infection control issue when you have double occupancy rooms. And so you may have someone with MRSA. Everyone, believe it or not, has some sort of MRSA, but if we have someone that has MRSA, active MRSA in our room, then what happens is we can't put someone that doesn't have MRSA in that bed, and because we don't want something to happen to them. So that also creates issues within that room. All of this to bring us up to speed, to current guidelines, to all that is really, really expensive. And we did a lot of work a couple of years ago and really taking a look at what the cost of fixing this is. Because there's some issues to create some more efficiencies within the facility, and it really was astronomical. We saw numbers from anywhere from $60,000 to $100,000 to really address the bigger picture. So we had to find a way forward. We had to find a way to provide that affordable health care to our communities, and so we developed a solution.
Carson Valley, unique in its landscape and geography, a gem in the high desert of northern Nevada, driven by a sense of community. A community dedicated to its history and land. A community with the pride of place and a community that cares for each other. As the healthcare provider for Carson Valley, it is our goal to bring forward a state-of-the-art healthcare facility to care for this community with all the skill, expertise, and technology you'd find in a larger city, but with the caring, compassion, and personal attention that comes from a small organization who treats our patients like family. The new expansion will be approximately 44,000 square feet, increasing the existing main hospital campus by nearly 50%, providing the necessary space to care for the Carson Valley and surrounding communities for generations to come. A study conducted in 2019 identified that the existing main campus was not capable of providing the state-of-the-art care for the growing community and provided a space program that would allow for CVMC to move forward. The physical result of that space program was an expansion that was designed to provide minimal disruption to the existing services and be constructed to provide current evidence-based and best practice delivery of healthcare services. The driving principles for this design are efficiency, space, and privacy. The services that are included in the expansion and renovation include rehab, emergency room, surgery, diagnostic imaging, and patient rooms. The total bed count will increase from 23 to 25 hospital beds, with all private rooms. Patients will have a better experience while in the hospital for care. Adaptability is important in the healthcare setting, a lesson learned during the COVID-19 pandemic. The new space will allow for the flexibility of higher intensity care with acuity adaptable rooms and the ability to expand rooms for airborne infectious isolation, protecting patients and staff. Each patient room will have 4 distinct zones: the patient zone, the family zone, a private bathroom with shower, and the clinical zone. Each room has a documentation station outside of the room with an observation window that can be utilized to view the room without disturbing the patient. The surgical department has expanded to include 3 larger surgical suites and 2 procedure rooms. The 3 OR rooms are served by a best practice clean core that is connected directly to the sterile processing area. This design allows for the one-way flow of clean to dirty equipment and instruments, mitigating the risk of cross-contamination. The operation and procedure rooms are equipped with a single large diffuser and integrated indigo clean lights, creating a continuously disinfected airstream over the surgical site. Cabinetry along the back wall allows items from the clean core to be available for use without opening the room doors. These design elements are essential in reducing the risk of surgical site infections. The expanded diagnostic imaging department will continue to offer the advanced imaging services to the community, including the latest technology in CT, MRI, nuclear medicine, and interventional radiology. The project will add an interventional cardiac cath lab, which will support the CVMC's expanding cardiology services to the community. The emergency room will grow from 5 to 12 exam rooms with an additional 2 observation spaces. The expanded space will also be designed to adapt to situations requiring isolation areas for infectious patients, something that proved challenging to many healthcare facilities during the COVID-19 pandemic. The emergency room includes 2 larger independent trauma rooms featuring a movable partition to provide surge space for up to 4 patients in the event of mass casualty, optimizing the staff effectiveness. The new rehab center, which offers physical therapy, speech therapy, and occupational therapy, will expand from the current 2,800 square feet to 8,500 square feet in a newly renovated area. This new space will allow for the additional equipment needed for new services and reduced waiting times. It is an honor and a privilege to care for the health and well-being of the Carson Valley and surrounding areas, a community that we know values substance over flair and purpose over pretense. The newly expanded hospital will serve our community with those values for generations to come, in a place designed to bring patients, caregivers, families, and community together for one common purpose: a healthier community.
So what do you think? So new facility for Carson Valley Medical Center, expansion of 44,000 square feet approximately. I think it's gonna be about 46,000 when it's all said and done. But something that's gonna improve patient safety and infection control standards, because we're bringing everything up to the current FGI guidelines. And also what we're doing from our current facility is we're moving over to this expansion, the inpatient unit, which includes our inpatient beds along with the ICU, our emergency room, our surgery department, and our radiology department, to include our new cath lab. Also, what we're doing is renovating some current spaces to take that the rehab services department, as I think the video mentioned, going from about 2,500 square foot to over 8,000 square feet of space for our department. And then we're going to increase the ER beds from 5 to 12 beds. We're going to increase our OR from 2 ORs that one is one size, one's another size, so it's kind of, the efficiencies there kind of are not appropriate. And we're going to be going to 3 full-size ORs, about 260 square feet apiece. And in addition to that is 2 procedure rooms where we can do endoscopies and do those back-to-back in those rooms. Going to go to all private rooms. We're going to add 2 more beds, so we'll go to that full capacity of 25, or the maximum capacity of 25 inpatient rooms. And then one of the things that's important to us when we did this was really not having to disrupt our services. So because we're replacing the new expansion, it's really going to have limited, if at all, any interruptions to our services. Some benefits: moving from shared hospital rooms to private rooms, improved air handling. You know, Sam mentioned fires earlier. One of the things we learn from fires is that smoke gets into the building and through the ventilation. So one of the things that we're going to be doing is really taking a look at that and making sure the ventilation system that we're putting in makes sense for that. And then also we learned a lot over COVID, and really from an infection control standpoint, what it is that we need to do to protect our patients and our staff even more than we do today. In brand new building, so enhanced environment. And you know, we really, when we started this journey over the last several years, we had really two major objectives when we started to do that strategic planning for this building. Number one was that Carson Valley Medical Center was going to do this on their own. We have two owners, and what we wanted to make sure we did is we didn't have to rely on our owners to help support us in this build. And in addition to doing that, we also wanted to make sure that there was not going to be an increase in healthcare cost to our patients and to the community that we serve. So during the course of construction, we're looking at around 100 to 150 construction jobs that we'll be creating. And then on the long term of this, with our over 460 employees that we have today, is actually increasing that over 20% over the time of this building over the next 5 to 10 years. When we went through this project and to get started to where we are today and to start this building project, it was really important to us to ensure that we had as many Nevadan subcontractors and contractors we could that made sense to and when possible. In addition to that, some of you may not know, but healthcare is the most highly regulated industry in the United States. Google it, it's true. And we wanted to ensure that whoever we chose, and it was important that those that we did choose were experts in the requirements for regulations, best practices for healthcare facilities as we went forward. And I would say, you know, I've used the Elevation Group twice in my career. Great group of guys that helped me help our facility navigate some of these rocky roads that we've had to go down. So thanks to them and thanks to the rest of the team that you see there on the screen. And I know there's going to be a lot more as we start hiring subcontractors and contractors along the way. So what's our timeline? When is it going to be done? When can we start seeing patients in that? Well, on October 15th, we're going to have our official groundbreaking there at Carson Valley Medical Center in our green space. We do have two of our projects moving forward right now. And those two projects are really, they were remodels of some other spaces. And they were expected to be finished, one on February 24th of 22, which is our sterile processing department that will support our OR rooms so that they can turn over faster. And then also our rehab center that will be completed on January 19th of 2022. So very excited about those. I know the staff are very excited about those to get those moving. And then we're looking at our new construction, the exterior site work to begin just in about a month from now. And then our new building construction begins May 4th. Really where you start seeing the big body of work happening. When they start doing the exterior site work, you'll start seeing some things happen. But then the new building really starts taking off on May 4th of 2022. And substantial completion currently today is expected to finish at the end of 2023. And the first quarter of 24 is when we'll take and start seeing our first patients in the new facility. So like I said, on October 15th is our groundbreaking. And this is going to be going to Renee. And we're going to be asking Renee to send this to all of our business council members. And all of you guys are invited to attend our groundbreaking ceremony. So thank you very much for allowing me to talk today, and I think there's some questions.
We do. So Sam is going to have some fun with you for a minute, and then we have a lot of folks online, and we've gotten a couple questions we're going to toss at you as well. Sam?
All righty. So first question is, what are you going to do with the vacated space?
Oh, that's a great question. So the vacated space, as I mentioned, what we're doing is we're moving the inpatient floor, the emergency room, the OR, and the radiology spaces to the new location. And so what we will be doing is bringing some of our business office that we have at the Ironwood Clinic back to the current location. And then on top of that, we're going to be, we have right now some of our clinical spaces like behavioral health in different locations. And I know our staff have been very patient, our patients have been very patient with us and all the moves that they've been through. And so we're going to be creating a whole space just for them in there. We're actually going to be extending our cafeteria. Right now we have the bistro, and what we're going to be going to is cooking foods right on site, and we'll have a nice place for people to come from the outside to eat, staff to have a place to eat. So expanding that over by the emergency room. We're going to create some meeting rooms on one side of the building so that we can have those meetings and also offer it to the community as needed. And then one of the other things that we're going to be doing is creating our breast center right there where currently where our mammography sits today, but we're going to be creating a breast center for women right there.
Okay, that's a lot of stuff. We got a question in that was something I was talking about, and you may know the answer, I don't know the answer, about these vaccination forms. And I was mentioning that when I went to the airport in Chicago, that we had a laminated copy of our vaccination certificates, and the airport would not accept that.
Sure.
And for international travel, they won't accept that. And somebody was saying, are they taking proof of vaccinations that are online via hospitals or drugstore apps? Are you familiar with the answer to that?
I'm not familiar to the answer with that. What, you know, I know that I've also traveled internationally, and it was different experience than you had. I do think that is going to be dependent upon who's the one that's requesting those cards at that time. But whether or not this is going to be accepted online or on an app, I don't know that.
Yeah, and it was interesting because our tests in Chicago were the results were emailed to us, and they accepted them as emails. Like you couldn't corrupt an email, which was kind of strange. So I think my advice at this point is, you know, check with the hospital or drugstore that, you know, to see if they believe it's being accepted. Check with your airline to make sure it's being accepted. And I would personally still carry my original vaccination certificate with me in my passport, so that way you're not risking your trip by that. Okay, I got one more question for you here, which is, you know, you're doing this huge expansion. We're seeing, you know, expansions in Carson City, South Reno. I mean, a massive hospital going up in South Reno. Renown is all over the place, and I know that you're partnered with them. What are we going to see from all of this? Are we going to see down the road, you know, costs being lowered, costs being maintained, costs going up for the patients? Because obviously that's one of the big questions about medical care.
Sure. I think you're going to see the cost of healthcare. You know, always there's a gradual increase in costs everywhere, and healthcare is no different. And I think we typically see about a 2 to 3 or 5% type of an increase per year in our cost. I think you're going to start to see that. However, I'm really interested in if this current bill passes, the $3.5 million bill passes, and what that impact is going to be on us. You know, I think also
trillion. Right?
Trillion. I'm sorry. Did I say billion? I'm sorry. A T with the
used
trillion.
To be billion. Now it's trillion.
Now it's trillion. I just can't count that high, so I forgot.
I ran out of fingers.
Yeah, exactly. But I think we're gonna, you know, as we see some of that come to fruition, we'll get understanding of that. I know that some of the costs that all industries have incurred since COVID, we've seen a drastic increase in those costs as well.
Do you think we're ever going to get to the point, and does it make sense for the industry where somebody can comparison shop? So if they want to have a certain procedure here, that they can go online and there'll be an app where they can compare costs and services? Yeah,
you can do that now. You can do that now. You actually can go, every hospital healthcare system is required to put their charges online. So you can go to our our website at cvmchospital.org, and you can see ours as well. There's a link there, and you can go see ours. You can go see it compared to others. And so, you know, but I would say, you know, when you take a look at those on behalf of other facilities as well, I think you got to take them with a grain of salt, because there's other things that can happen that we don't know will happen when someone comes into, because everyone's different, everyone presents different, and so the treatment for those patients are different. So while we can give a gross charge for something, it's hard to get specific until that visit happens.
Renee, you have any more questions here?
We do. Thank you so much. So we have several questions that are coming in. Kathy, can you toss out one of our members' questions that we have ready to go?
Absolutely. Jeff, that was a fabulous presentation, and great things are happening. But I also wanted to thank you for your service in the Navy.
Oh, thank you. You're welcome.
But from one of our members, we would like to know if you're going to have a cardiac rehab program there, and if so, can you elaborate on it?
Yeah, so our goal is to really create a service line for cardiology that will not include open heart surgeries and things like that. I think if someone needs that, there's other facilities in our region, to fulfill that need. But we are looking within our physical medicine and rehab expansion there to start our cath lab. Start our cardiac rehab in that space as well. So yes, you bet. Thank you.
All right, Jeff, so we have another question coming in from one of our members.
Okay.
So since 1993, you've been known as the Carson Valley Medical Center. Is that going to change anytime soon?
Actually, before that, we were known as the Barton Clinic. And so, and there's a lot of people out there today that still call us the Barton Clinic. And, and that's totally fine. Known as the Barton Clinic. And then we changed our name to Carson Valley Medical Center. But who knows? Right now, who knows if that will change? As our services change, as we start to have a broader breadth, do we do something that really connotes what it is and who we are on a broader scale? Other questions?
Jeff, we have a question. What is the current patient volume on an annual basis? I guess you could say on a normal year, but there was a difference because you had a COVID year where you had patients you weren't expecting, but then you did not perform non-mandatory surgeries. Those patients you were expecting were not allowed to come.
Right.
So it's kind of, I'm not trying to make it a trick question, but maybe even carve that year and a half out. I don't know. What do you think?
Yeah, I think, what we did is when we did take a look at that and said, okay, is 2020 the new norm? We kind of looked at it when we did our planning from last year, kind of looked at it from the aspect of, and I hate to say it this way, 2020 did not exist.
Right.
And we kind of started from 2019 and kind of moved forward from that. And so I think what we're seeing there, I think we're seeing a shift in how people receive their care. We're seeing a lot more online type of some of the telemedicine deliveries, and we're seeing that. And so it's just really changed in some of the dynamics. We're seeing higher volumes in some areas, lower volumes in other areas, but overall we're seeing that trajectory still increase.
So can we talk about telemedicine for a little bit? I know if you have an appointment in the middle of the day, you've got to leave your office and your workforce, and you've got to drive to the visit. You've got to sign in, wait, etc. And sometimes running late, and you finally get your visit done, and then signing out, and then driving back to work. You're looking maybe 2 to 3 hours.
Right.
So we did say that there were some times where some good things came out of it, and doctors were working triple time, and nurses and PAs and support staff who were all needed every day, and they were essential, and they came to serve. And they had to figure out how to use laptops and computers and all those things, and your IT probably went crazy, like every other medical office. So do you think that will stay? And will that relieve the pressure for your actual traffic in the new facility for you to handle volume of more critical things that people will wait less, perhaps?
Yeah,
Can you talk about that?
Absolutely. Well, first, I think, telemedicine has been around for several years. And there's other states that I served in, Alaska, Montana, where that was just the way we did things. And so it's really not, first off, it's not new way to deliver service. It's just new to some of us and how we receive care, or how it's being delivered, or even providers and how they sit in front of the camera and see a patient. I think what we're going to see, and we've started to see this, there's certain primary care type of services that we saw a big increase in, and then once things started to open back up, we really saw a shift of those decreasing, and other types of services on telemedicine increasing as well. So it's just, I think we're going to start seeing it as people understand and get more comfortable with it. I think we're going to start seeing shifts in who and where those are being delivered. For example, behavioral health started telemedicine a long time ago, and is really something that has really set kind of the telemedicine standard is from that service line.
It's incredible. Well, from all of us at the Business Council and the community, we can't thank you enough for being the incredible leader that you are at Carson Valley Medical Center and far beyond. How long did the process take for you to be able to break ground next week?
Well, I guess from the start of my tenure here, we've been talking about it. But even before I came, there were other opportunities that we looked at, the campus plan and what it looked like and what it could be. But over the last 3.5 years almost, we've been talking about how are we going to make this happen? How are we going to be able to afford this? How are we going to pay for this? And how are we going to pay for it over the long term? So I would really say probably, I think my first board meeting, we had a conversation about the expansion plan. So it's been over 3 years in the making since my coming on board.
And in the making it shall be.
Yeah.
Congratulations
Well,
to
thank you.
everybody. We'll watch with pride as the progress grows, and the community will have to adjust and pivot to coming through and being safe, not necessarily in a full
Absolutely.
construction zone, but I'm sure there's going to be adjustments in where they used to enter and then during construction where
Yes.
they need to enter, see their doctor, that kind of thing. But all your critical care is 100% 24 hours a day, correct?
Correct. Not stopping. Nothing's closing during the construction. And even those entry and exit doors will kind of remain the same. There's not going to be. That's one of the great things about this project is it's just staying right where it is. And
Perfect.
services, yeah.
Thank you so much,
Thank
Jeff.
you.
Everybody give Jeff Prater, CEO, Carson Valley Medical Center, a hand. They have been preparing
Thank you,
for
sir.
this, building these big announcements, and we are so excited. Sam, back to you.